Welcome back to the exam room, where we explore the real world challenges shaping healthcare, delivery, and value based care. Today's conversation tackles a tension that many healthcare leaders and frontline staff are feeling right now, and that's how do we improve outcomes and meet performance metrics without losing sight of the patient as a human being? Our guest today is Pamela Knowlton, an RN and experienced case manager who has spent years working with high-risk patients and ACOs in Connecticut, particularly in areas like COPD, congestive heart failure, and diabetes management. Through her work in patient education and care coordination, Pamela developed a deep passion for patient-centered care, but also has growing concerns about what happens when healthcare systems become too focused on numbers, workflows, and productivity at the expense of relationships, education, safety, and trust. In this episode, we'll talk about the human side of value based care, the growing pressures facing providers and staff, and why truly understanding the whole patient may be more important than ever. Pamela, thank you so much for joining us today.
It's a pleasure to be here.
Tell us a little bit more about your journey up to this point.
I was actually a late bloomer, and my first gig, so to speak, out of nursing school was cardiac PCU, which is where I started learning about just how important it was to try and catch things before it got to the point where people were hospitalized. After that, I just kind of started venturing into different areas, home health, which got me into the case management portion and more of being able to build a relationship rather than just having that bedside nursing where you had them for that very short critical period and then boom, they were gone. I've kind of evolved trying to develop relationships. That is kind of who I am at my core, and knowing the importance of preventative care just became a passion for me after seeing people's journeys and how they respond to um, instructions and recommendations and basic orders from a doctor that they really don't get to spend much time with, and trying to turn that into a lifestyle change. So case management kind of became my passion.
Absolutely. I can see that. The first 15 years of my career was in the operating room where building rapport with patients was not part of my responsibility, right? Like they were
Yeah.
asleep. Yes, there's the team aspect of things. But then as I moved into higher education, eventually became a program manager, and then it was my responsibility for student retention, right? So I had to discover the hard way because nobody taught me this, but retention is directly tied to relationship building. I think just innately as humans, relationships are the secret sauce, right?
Absolutely.
That connects us and it tethers us and strengthens those bonds between us. You spent years managing high risk patients and working within ACO environments. At what point did you begin to feel disillusioned with the healthcare system?
When I started noticing that although the speak was patient centered, it started turning out into more of volume and saving money at the cost
Mhm.
of the patient, of the relationship. And it started to weigh on me, for lack of a better word. And the more I saw and the more I tried to mitigate those things, the more evident it became that it's a business. It's not healthcare, it's a business. And
Mhm.
that really disillusioned me.
Did you feel like corners were being cut?
To a degree, yes, because when you have the directive that patient education. We need to keep them out of the hospital. We need to get them before they get to the point where the COPD is so bad or the CHF is so bad. It turned into, what are you going to do and how many people are you going to touch to keep them out of the hospital? It wasn't about building that relationship and teaching that
Mhm.
patient why they are doing the things they are doing. The corners that were cut were in the relationship field, were in the developing of that trust and of that knowledge base, to the point where it just turned into, well, somebody's been in the hospital. Now you need to call them within this amount of time, make sure they've got this, make sure they've got that, and then move on to the next. It was dehumanizing.
Mm. More like one size fits all kind of cookie cutter approach.
Correct. Yes.
So at one point in our previous conversation, you said something to me that really kind of rattled my brain. You said you needed to be able to look in the mirror and know you were doing the right thing. Can
Yes.
you explain to our listeners a little bit more about what that was and what that felt like?
When I started seeing that the system was trading convenience for what was right, for just throwing medications at a person rather than teaching them and taking the time to make sure that they understood and that they were invested in their health. A lot of the case management is, it's like the food pyramid, where you can't get to the person being able to take care of some needs if their basic needs aren't being met.
Mhm.
But what started happening, it was there on paper, it wasn't there in practice.
Mm.
And just because you tell somebody they need to do something, they need, take this medication, take that medication, where somebody might be taking too many or not enough, and not looking at the person as a whole. I couldn't do that anymore, because they are people. This is somebody's mother, this is somebody's son, this is a spouse, and they matter. And what I do matters, because if I am just part of that system that is doing the cookie cutter approach, that is not looking at the individual as a whole, what am I doing?
I mean, we're all patients, right? We should all be able to get to this place in our brains of like what I want for my care, even as a healthcare person, and understanding the system and the barriers that we have when we're talking about even relationship building or education, getting that patient to a place where they're ready to receive that.
Mhm.
It's just like you said, it makes me think of Maslow's hierarchy of needs, right? Where if your physiological needs are not taken care of, I need air, I need water, I need food. I can't move up to even thinking about that next level, which is what safety needs, I think. Part of that then becomes removing the barriers for our patients. Like, then that makes me think, and I want to know your thoughts about this, like the role of advocacy on our part as healthcare providers, but then also empowering the patient side, right? It's a relationship, so two people need to be involved in that. What are your thoughts?
You can tell somebody you need to take this pill 3 times a day. If they can't afford that medication, what are they doing? And if you can't explain to them, this is the reasoning behind it. In order to even get to that point, there has to be a relationship.
Mm,
And when it
mhm,
turns into a numbers base, and we've all seen it, you go in to see your PCP, and unfortunately, they're typing on the computer while they're trying to talk to you. And doesn't that just make you feel a little less human? And that's as a healthcare provider that I'm seeing it. When needs are not being met at a basic level. And oh boy, you're going to get me on a roll here. You want to talk about medications. How often is somebody prescribed something and then all of a sudden they go to the pharmacy and they're told, oh, that's not formulary anymore. We're not going to cover, your insurance doesn't cover that. Then what? Where does this leave the person? Where does this leave the family that is trying to get the help for that loved one that
Mm,
needs a medication, that needs the education? It's just not there. We
mhm.
have turned into a sick care system, not a healthcare system.
It's not the first time the sick care system has come up on this podcast. I will tell you that it's very reactionary. I think that's why, to me, when I started working for VB Care and ABC Network, I had no idea what value based care was. Like, what? I had never even heard of that before. And it immediately resonated with me. Like, this makes so much sense to care for ourselves as patients and for patients as healthcare peoples before there's a crisis on our hands, right?
Right.
We have trained our patients to be very reactionary, I think, in some ways when it comes to their health. They don't go to the doctor a lot of times unless they're not feeling well, right? What else brings you in? I got a pain here that I didn't used to have, or I got this little cough, or whatever the case may be, and then they come in. That's why I think value based care is so beautiful in what CMS is trying to do. These aren't really things that haven't been said before,
Mhm.
but we need to keep talking about them so that we can affect change, and even if that's bringing the patients along, like maybe the provider's hands are really tied and there isn't anything else that they can do. I think I was chatting with my friend, and she was saying her GYN decided, like, the big mainstream practice wasn't for her. She moved into this very, very small building, not fancy at all. She sees a small handful of patients a day where she can really give them the time and the care that they need. It was a huge, huge lifestyle change for her, but for the betterment of her patients. And then, like you said, you have to be able to look at yourself in the mirror every day. So she needs to be able to look at herself in the mirror every day and say, hey, like, I'm doing the right thing for my patients. As we continue to talk about this, it will inspire more people to do the same. That's my hope.
Thank you for listening to The Exam Room. In our next episode, the conversation continues as Pamela Knowlton explores the growing tension between healthcare metrics and meaningful patient care. Can organizations balance quality measures with genuine human connection? What would it look like to measure relationships alongside outcomes? We'll also discuss why prevention should begin long before patients become high risk, and how small changes in the way we deliver care could lead to healthier patients and stronger healthcare systems. Join us for part 2 as we continue exploring the human side of value-based care.